Bonjour. Good morning. I want to start off today again by talking about the third wave and how hard it is hitting people across this country. And we are seeing really, really deeply disturbing examples of how hard the third wave is hitting communities that are the most vulnerable. We are seeing some of the most vulnerable communities, frontline workers, racialized workers, the people that are essential, who have to go into work, who can't stay at home, are the ones that are getting sick and are the least likely to get vaccinated. And again, we are highlighting how important it is to have paid sick leave that actually works. We fought hard to bring in paid sick leave, but at the federal level, it simply is not working and we need to improve it. And we've been asking Justin Trudeau to improve access to paid sick leave. Experts have added their voice saying that it needs to be better and that a good functioning paid sick leave can save lives. And we just saw a really heartbreaking example of what is at stake. In Brampton, a 13-year-old girl, Emily, lost her life to COVID-19. And the story that was told by Globe and Mail is a heartbreaking story that really illustrates how this is something that is impacting young people. Father didn't expect that there was anything wrong. His 13-year-old daughter, as the story recounts, was giving him the usual attitude that a 13-year-old we might expect might give to a father who is worried about their health. And it seemed fine until the next day he checked on her and she was dead. He was a worker that had to go into work. He did not have access to paid sick leave. We know that paid sick leave can save lives. Emily, 13-year-old Emily, did not have to die. This is what we're up against. We need to immediately vaccinate everyone who needs it most, get them the vaccine, and we need to make sure there's paid sick leave. So again, we are redoubling our call to bring in paid sick leave that actually works. This is vital, this is important, this will save lives. We need to do this immediately. Donc, on a vu à travers le pays que la troisième vague de la COVID-19 frappe fort. Et ce qui est aussi surprenant ou étonnant, c'est le fait que encore, c'est les communautés les plus vulnérables, les travailleurs et travailleuses essentiels qui sont les plus frappés et qui ont moins d'accès au vaccin. Et ça, c'est aussi un problème qui continue. On sait aussi un outil essentiel pour faire face à la COVID-19, pour arrêter la propagation, c'est accès à un congé de maladie payé. Et c'est essentiel qu'on augmente, améliore le programme fédéral pour un congé de maladie payé parce que tous les experts sont d'accord, ça ne fonctionne pas à ce moment. On doit le changer, on doit l'améliorer. On a, depuis des mois, exigé Justin Trudeau d'améliorer notre programme de congé de maladie payé. Il n'a rien fait. Et c'est inacceptable. Il doit agir maintenant. J'ai lu l'histoire, plusieurs personnes ont lu l'histoire de Emily à Brampton, une fille de 13 ans qui a perdu sa vie à cause de la COVID-19. Et dans l'histoire qui a été rencontrée par Globe and Mail, le père était un peu inquiet. Il a essayé de vérifier la santé de sa fille et elle a répondu avec la même attitude qu'on voit souvent avec les jeunes de 13 ans, donc il n'a pas des grandes craintes, mais la prochaine journée, elle était morte. Ça, c'est le taux de cette pandémie. Et comment on peut agir à ce moment pour sauver les vies, c'est d'améliorer l'accès à le programme de congé des maladies payées et on doit vacciner tous les gens qui en ont le plus besoin. Donc, on va continuer de mettre la pression pour faire ça. We're going to continue to place pressure on this government to do that. And with that, I'm ready to take your questions. Je suis prêt de prendre vos questions.
Et nous allons passer aux questions, commençons par les questions au téléphone. Un petit rappel, c'est une question suivie par journaliste. We'll now take questions, starting with questions on the phone. Quick reminder, one question, one follow-up per reporter. Operator, do we have a first question?
Thank you. Merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question, Raymond Sillon, TVA. Your line is open. À vous la parole.
Merci. Bonjour, M. Singh.
Bonjour,
Votre
monsieur.
parti, au cours de la fin de semaine, a clairement fait savoir que vous êtes contre une intervention fédérale dans le conflit au port de Montréal. Pourtant, le gouvernement, ce matin, se dit déterminé à aller de l'avant si nécessaire. C'est ce que réclament aussi plusieurs intervenants économiques, gouvernement du Québec, gouvernement de l'Ontario. Pourquoi êtes-vous si opposé à une loi spéciale?
C'est exactement l'opposé de ce qu'on doit faire. Si on a un problème, s'il y a un problème pour les travailleurs et travailleuses, ils ont le droit de régler ce problème eux-mêmes sans avoir l'intervention du gouvernement libéral ou du gouvernement fédéral. Ça nuit à la capacité des travailleurs et travailleuses de régler leurs problèmes. C'est exactement pourquoi on a des syndicats, parce que c'est eux qui doivent régler ces problèmes. Deuxièmement, les travailleurs et travailleuses, les syndicats sont clairs. Ils ne vont pas arrêter les produits, les matériaux essentiels. Et ils ont déjà fait cet engagement. Donc, c'est un problème qui existe entre les travailleurs et travailleuses et les compagnies. Donc, les travailleurs et travailleuses ont le droit de régler le problème eux-mêmes. Et pour avoir un processus ou pour avoir un système qui fonctionne, on doit avoir les travailleurs et travailleuses qui sont bien payés avec une bonne condition de travail. Ça nous aide tous. Monsieur Fillon, ils ont demandé en anglais et puis je vais répondre à votre suivi. With respect to the ongoing conflict or the labor conflict in the Port of Montreal, I have been opposed and will continue to be opposed to the Liberal government or any government intervening because workers should be able to solve these problems themselves. And the workers and the union made it very clear they will not stop the flow of essential goods that have been identified. They will make sure that those goods get across. And really, it is contrary to the way things should happen for governments to step in when there's a conflict between a worker and an employer. They should have the ability to negotiate and work that out. That's their right, and that's important. And in fact, it's better for everyone when workers are able to negotiate fairly. They're able to do their job properly. It is actually in everyone's best interest that that's the way things are solved, not with the government with a heavy-handed approach of intervening. That is the wrong thing to do. Puis votre suivi?
Oui, même si les marchandises essentielles transitent par le port de Montréal, reste que l'impact économique du débrayage est très grand. Est-ce qu'il y a un point où le NPD pourrait appuyer une loi spéciale?
À ce moment, au début de cet enjeu, c'est clairement pas correct de faire. Et en général, on est un parti des travailleurs et travailleuses. On appuie l'importance de toujours respecter la capacité des travailleurs et travailleuses de régler les problèmes eux-mêmes comme ça. Donc, pour nous, c'est une valeur, c'est un principe et on appuie. On peut régler ce problème, mais c'est en appuyant le processus, en appuyant les travailleurs et travailleuses.
Opératrice, prochaine question.
Merci. Thank you. Our next question, la prochaine question. Catherine Lévesque, La Presse canadienne. Your line is open. À vous la parole.
Oui, bonjour, M. Singh.
Bonjour.
On ne vous a pas encore entendu sur les frontières. Je me demandais qu'est-ce que vous avez pensé de la suspension des vols en provenance d'Inde et du Pakistan. Et pensez-vous que le gouvernement fédéral doit aller encore plus loin en suspendant tous les vols internationaux?
Avec les vols internationaux et les voyages en général, c'est quelque chose que je dis et je suis triste de le dire, c'est le fait que le gouvernement libéral a vraiment manqué leur responsabilité. C'était un échec, le fait qu'ils n'ont pas fait le bon travail pour sécuriser ou pour protéger les frontières. C'est clair, il y avait un manque de programme, un plan pour protéger les Canadiens et Canadiennes. Donc, c'était clair avec les actions et les inactions, effectivement, du gouvernement libéral. Les quarantaines qui ne fonctionnent pas, pas des mesures concrètes pour protéger les frontières en général. Donc, c'était un problème. Ce qu'on doit faire, on doit toujours suivre les conseils des experts en matière de santé publique et on doit aussi reconnaître la menace de propagation de l'infection de la virus par les frontières. Et c'est important d'avoir des mesures qui fonctionnent. On peut on peut voir ce qui a fonctionné dans les autres pays et mettre en œuvre un programme qui fonctionne. Ça, c'est essentiel. Et la décision pour n'importe où on a ce qu'on appelle des hotspots, où on a des grands montants d'infection, qu'on doit arrêter les vols pour protéger les Canadiens et Canadiennes. C'était une pratique qui a fonctionné. Les autres pays l'ont fait. Et c'est quelque chose qu'on doit continuer de faire avec le conseil des experts en matière de santé publique. Ils ont demandé la même question en anglais et puis la réponse en anglais et puis je vais répondre à votre suivi. So when it comes to the borders in general, I say this with a lot of sadness that the Liberal government has failed us. I don't take any pleasure in saying this because we want this to work, but it's clear that they have failed when it's come to quarantining, to having a clear plan around the borders and around the real threat of infection being spread across the borders. The Liberal government has a failed quarantining program. They've not done enough to make sure that our borders are safe, and it's shown with some of the spread. I do support measures whenever they are supported by public health to stop travel where there are hotspots or areas of high rates of infection where we want to protect Canadians. That's an important tool in our arsenal to fight this spread, and it's something that we should be willing to use when it's appropriate with the advice of public health. But this is something we've seen in general that the government has not done a good job of. We need to be better at protecting Canadians from the potential spread of infections that can happen with travel. Et puis votre suivi?
Oui, donc c'est pas tout à fait clair. Je me demandais juste si vous étiez d'accord finalement avec la décision de suspendre les vols en provenance d'Inde ou du Pakistan, ou si on s'attaque peut-être à ces pays-là plus qu'à d'autres. Et mon autre question, en fait, c'était juste de savoir si vous pouviez nous partager la décision concernant le vote sur le budget. Vous avez déjà dit à de nombreuses reprises que vous alliez voter contre une élection, mais ma question, c'est de savoir est-ce que vous allez voter pour le budget ou est-ce que le NPD va s'abstenir? Merci.
On va continuer de maintenir notre position qu'on on va voter contre une élection. Ça doit être clair. On est dans une troisième vague de la COVID-19. Je viens de rencontrer une histoire d'une fille de 13 ans qui a perdu sa vie à cause de la COVID-19. Donc non, on n'est pas d'accord avec une élection à ce moment. On va continuer de mettre la pression pour les changements et pour l'appui dont les gens ont besoin. Et on va continuer de faire ce travail, mais non, on ne va pas voter pour une élection. Donc, ça veut dire qu'on va appuyer pour continuer de faire le travail important pour aider les gens.
Operator, next
Vous
question.
allez appuyer le budget.
Thank you. Merci. La prochaine question. Our next question. Lee City News. Your line is open. À vous la parole.
Hi, thanks for taking my question.
Of course.
I wanted to ask some more on your thoughts on border controls. We've heard stories of travelers who are able to avoid some of the more severe quarantine measures by simply flying to the U.S. and then driving or in some cases walking across the land border. Obviously, it's very difficult to secure that border given the transit that goes back and forth across it, business that goes across it. But is there some sort of an example of a plan that you would like to see enacted to help tighten that up?
Certainly, and I just want to start off, I should have said this in previous questions. While I think that there is a real threat that public health experts have outlined around international travel and spreading of the infection because of travel, I know that the experts have said that the most important thing we can do right now is to protect workers who are getting sick at work. And that's why we really are emphasizing the paid sick leave. And so previous questions, I acknowledge the real concern, and we've got to do better. And countries that have done a good job of quarantining and have been really effective are, of course, Australia and New Zealand. They, of course, do have unique advantages, being the geographic barriers that they have naturally with being islands or being separated by water from other travelers. So they certainly have certain advantages, but they put in place a really strong quarantining process that worked. But I got to emphasize that right now the experts are telling us that most transmission is happening in large workplaces, warehouses, factories, where essential workers that have to go into work are going into work and getting sick. Workers are not staying home when they're sick because they've got no paid sick leave. That means that they've got to make this impossible choice. Do I go into work sick, or do I stay at home and I don't have any pay and I'm not going to be able to put food on the table or pay my bills? So That is what we've got to address, and all the experts are saying that is actually the most important thing. The highest rates of infection are in workplaces, and that's why we need paid sick leave. So I just want to make sure that that's clear, that that is, to me, the most important thing, the immediate thing we need to do. But of course, we should look at all tools, which include looking at better border protection.
Opérateur.
Thank you. And as a follow-up,
Yep.
I apologize, I'm going to have to ask you about the border again rather than paid sick leave, but there is some concern that air travelers can refuse that 3-day mandatory hotel quarantine by just paying the fine. Are you concerned that this essentially constitutes a free pass for people who can afford to pay?
Yeah, there are clearly problems with the Liberal government's approach to protecting our borders in this pandemic, and we've seen it from the beginning. Lack of action early on, lack of quarantining from the beginning, lack of strong measures to protect people from the potential spread that comes from international travels. And you've outlined another example that people might just pay the fine. And again, that undermines the whole point. So there's got to be a better way of protecting our borders and a better way to quarantine and a more effective way to quarantine so that when people come in, they take the appropriate time and ensure that they're not spreading an infection. There has to be better ways, better checks and balances in place. And I absolutely agree. I just, again, will reiterate that paid sick leave is something that immediately we can do, which would stop what experts are saying is the immediate threat.
Et nous allons maintenant passer aux questions dans la salle. We'll take questions from the room. Mike?
Mr. Singh, Mike Liquiteur with Global National. I wanted to ask you, ahead of the Johnson & Johnson vaccine rolling out here in Canada, there's a poll that suggests that confidence in the Johnson & Johnson vaccine is waning and dropping. I wanted to know, what do you think that this government can do to combat vaccine hesitancy better, besides politicians such as yourself and the Prime Minister going out and saying, hey, look at me, I'm getting AstraZeneca, especially when it comes to how people are hesitant about it? What more can be done?
I think the more transparency, the more people know about what's going on, the better it is in general. It gives people more trust in the system. I think that the delays that we've seen and a lack of a clear rollout plan has also eroded that support. The lack of access, the fact that people apply to get a vaccine appointment and then their appointment gets canceled, increases distrust because things aren't working and then they start to doubt. So I think we need to have a system that works. We need to get vaccines to people who need it most. And we need really good transparency around the fact that these vaccines are approved by really stringent Canadian protocols. We've got some of the best independent and great folks that are working to make sure that anything that is approved in Canada meets really rigorous standards, so people can trust that. Trusting in general that vaccines are vitally important in our journey in terms of human health. Vaccines have been one of the most important tools to keep humans healthy. We have been able to combat really serious illnesses with vaccines. So just doubling down on how important vaccines are, generally speaking, and how they help us out and how they have helped us out. More education, more awareness, and just making sure we've got a system that works so that people can book an appointment, get a vaccine, and that trust will build. Right now, we know that there are people that are losing their life because they haven't been vaccinated. The more people that get vaccinated, the better off we will be, the safer we will be, and the closer we can get to getting back to a position where we can still interact with each other in a way that we miss doing.
So I know, as a follow-up, I know you're saying more transparency, but we've had Dr. Tam and everybody trying to advocate for them. And then Dr. Tam also saying that we need about 75% of Canadians to be vaccinated to start to really lift restrictions and to make it safe for a hospital without overwhelming hospitals. Do you think that we'll get to that 75% because of how much hesitancy is out there right now?
I believe we have to get there. So, I mean, I want to jump over that and say we have to get there. And I'm confident we can get there. I am absolutely confident we can. It just means that we've got to get really serious about getting the vaccine to people who need it most. That's where we're really seeing the gap, is that in some of the richer communities and some of the communities that need it the least, have the least infection, we're seeing high rates of vaccination. But we really have to target the approach. Like, we have to make sure the approach to getting people vaccinated looks at who needs it most, who is most at risk, and then we have a plan that does that. I think that is something that's been missing, and I think we need to focus on that. We need to make sure that there's campaigns that reach out to people in their communities, in the language, and in the way, the communication stream that is most effective to get out to people. There has to be a clear effort that matches how serious what we're going through is, and also that has the right resources to support the way to get that information to people. There is a way, and I'm confident we can do that. We'll continue to fight to make that happen.
David?
Hi, good morning, Mr. Singh.
Morning.
So maybe I didn't hear this, but are you open to possibly restricting flights from all international destinations? Is that something that you'd be open to supporting or seeing the government do?
Well, on limitations on travel and kind of restrictions in general, I want to be very clear on this. We've got to look at what is the public health advice and what is the best practice possible so we can keep people safe. I'm open to whatever is in the best interest of Canadians and what will work to keep us safe. And so if that includes some travel restrictions or increased travel restrictions, I'm prepared to look at the evidence and then make a decision that supports what experts are calling for. So whatever that is, let's be open to that. But what I want to highlight is the urgent and immediate threat that the public health experts who I keep on referring to are saying right now is the biggest threat is workplace infection. They're not saying that it is the biggest threat right now is through spread because of air travel. If they come to that point, I think we'll have to look at that. Right now, they're saying very clearly the biggest threat is actually in workplaces. People are getting sick in hotspots, and hotspots are where there's a high rate of essential workers, people who have to go to work, can't work from home, people who work in crowded workplaces, where they work in a factory or a warehouse, people in logistics and transportation. These are the people getting sick. And the experts are saying to stop that spread, people need to stay home when they're sick. The only way they're going to do that is if there's good paid sick leave. So we can go to other areas and look at other potential risks, but we should definitely deal with what the urgent and immediate threat is, which is workplace infection and workers who don't have the means to stay home. That's got to be our priority, and we've got to vaccinate those people that are hardest hit. That should be our approach right now. And I want to just highlight, I want to follow the evidence, and that is what the evidence is saying. These are the people that are getting sick. These are the people that are desperate, and these are the people we need to support and protect right now.
So shouldn't you be pushing Premier Doug Ford for paid sick leave? Because, I mean, this is under his control right now. This is something that he could do right now. It would be easier for him to do what you're calling for than the federal government to bring that about. So shouldn't what you're saying today be directed to the Premier of Ontario?
I really appreciate this question because, yes, Doug Ford is sadly a colossal failure and needs to do a lot better to get help to people. But we have a federal program right now. It is there. There is a federal program right now that workers can access right now. But the experts have said, while there is a federal program right now that we fought to establish for paid sick leave, there are problems with that current program. And that current program's problems are so much so that there's not enough uptake. The budget was in the billions in terms of how much money was budgeted for this paid sick leave program, but the uptake has only been about 400 million. It is simply not working. And the reason it's not working is the existing system has to have like 3 tweaks. One, it's got to be more flexible. Right now, you can only take 5 days at a time. And experts have said it needs to be more flexible. People need to be able to take a couple days to figure out if their symptoms are going to resolve or not, to figure out if they're actually sick. And it's got to be enough money to cover someone's actual work. So the amount right now is just not high enough for someone who goes in and works and earns a certain amount. When they take the paid sick leave, it doesn't cover their bills. It doesn't cover what they would have made if they went into work. If it was high enough to cover their pay, they would take it. And that's what the experts are saying. And thirdly, it has to be quicker. It has to get to people quicker. And so that whether that means a quicker processing time or making sure that it goes through employers so the employers can just pay them directly. They don't have to actually apply for it. We just have to make it quicker. These are 3 things that need to be done for the existing program that's already there. It doesn't have to be a new program that provinces, we have to wait for them to figure out, and different provinces across the country and territories will have to figure out. There is a program right now that is available that workers can access, and they're not accessing it because it's simply not working, and we can make it better. And that's why we're saying instead of waiting for other provinces to figure it out, and maybe a province like Ontario where Doug Ford doesn't care or doesn't seem to want to talk a lot but doesn't do anything, let's get something done at the federal level that we already have it in place and make it better.
Lee?
Yes, sir. Lee Berthium, Canadian Press. Good to see you. I wanted to ask about India. The federal government earlier in the pandemic was criticized for sending supplies, PPE, and other equipment overseas. We're now, promising some aid to India. Do you support such a measure? If so, are there certain things we shouldn't be sending, and how fast or slow should we be moving on this?
This is a global pandemic, and it's really showed how much we're connected. If there is an outbreak in any part of the world, it impacts all of us. We have seen that impact. We've seen the spread of the pandemic, and how when it is flaring up in certain parts of the world, it impacts the rest of the world. We are all very much connected, and this pandemic has really shown how true that is. So we absolutely need to help other countries around the world. And right now, India is going through a horrible situation. It is catastrophic. The case counts, the horrible conditions in hospitals, and what people are going through right now is horrible. So they absolutely need our help. We have to consider ourselves global citizens, and we have to look around the world and see how we can help. That's why we had said in the beginning, I was troubled by Canada being the only G7 country that was accessing COVAX, because we should be supporting the vaccine distribution around the world. We should be helping that. That's why I said it was a problem that Canada is not able to produce our own vaccine. Not being able to produce it here means we're not able to get enough for our own citizens, but it also means we're not able to help and assist in the global struggle against this pandemic. So we should do whatever we can to support countries around the world that are struggling. All countries should come together and support. We also, of course, need to make sure that Canadians have access to PPE and the vaccine here. And we've got to look at what we can do to support Canadians and people in our country, as well as how we can be good global citizens to help people around the world tackling this global pandemic.
And on the budget, you said in French that you will vote against an election, that you are not okay with an election at this moment. Will the NDP be voting in favor of the budget motion?
So, I want to again be clear, we are not in any way in a third wave with how bad things are. And I just talked about how bad things are and how young people are losing their life to COVID-19. I talked about Emily and how desperate and dire the situation is in Ontario and numbers that are rising across the country. There is no way we would, in this context, trigger an election. It would be the wrong thing to do. So we are not going to vote for an election. We are going to vote to continue to support people and get the help that they need. And so that's what we're going to do with this budget. We're not going to trigger an election. We're going to vote to continue to fight for people and get them the help they need. Use our position to push for more support wherever we can, but we are not going to trigger an election.
And that's all the time we have. Ceci met fin à la conférence de presse.
I did, yeah. Yep. You know what? I just, to be super honest, so I got it done the first day, obviously nothing. And the next day, it's important for folks to know about this. I think it's fair. The next day, I did get some symptoms. I felt a little chills and a little bit sore, but it was fine after that day. So just one day, might happen to people. It's normal that you sometimes get a little reaction the next day. I was still able to work though. I went to work, but I think it's important that people are able to take time off. That's why the paid sick leave would be so good. But I took it. It's fine. Everybody take whatever vaccine you can as quick as you can. The soonest you are eligible and whatever vaccine is available, please take it. Thanks.
Ceci met fin à la conférence de presse. Merci. This concludes the press conference. Thank you.